You're sitting on your chair, sipping your lemonade, chilling, minding your own business, and all of a sudden your 5-year-old comes along and says, "My head hurts." You panic and Google the symptom, 5-year-old headache. And the first diagnosis that it brings is brain tumor. You panic much more and forget about the fact that she has runny nose and sore throat. You take her to a pediatrician and says, "Well, your child has a common cold." Give her some fluids, tea, soup, honey, and she will be okay in a heartbeat. So in this episode I will telling you what to do, who to call, and where to go if your child is experiencing a headache. So feel free to grab a cup of coffee, relax and sit through the video. I'm Armin Djebreili, a medical doctor based in Armin, Iran, working as a general practitioner in local medical clinics. Well, I've had so many interactions with patients experiencing headaches, and as a neurology enthusiast, I've committed a fair amount of time and effort to studying neurological emergencies and common conditions. Firstly, I'll give you an explanation about headaches and their subtypes, and then we'll talk about what to do and when to seek medical attention. So, without further ado, let's dive headfirst into headaches. First of all, we have a fairly round object on top of our torso and neck called head. It sometimes can hurt, which is quite common actually. Up to 60% of children reported headache over a period of time, and by the age of 18, up to 90% of individuals have experienced one episode of headache in their lifetime. First of all, we categorize headaches as primary and secondary. Well, primary, mostly in medical terminology, means pertaining to the organ itself, and in the case of neurology and headaches, it's pertaining and containing and concerning about central nervous system and without any other etiology. And secondary, which in medical terminology means because of an underlying medical condition. Let's say meningitis, which is an infectious disease, or SAH, which is a hemorrhagic condition, and so on. The most common subtypes of headaches are migraine and tension type headaches. Migraine is a sort of episodic form of headache lasting from 2 to 72 hours if not treated. It's pulsatile, meaning pulse-like headache. Bilateral, meaning mostly two sides of the head with light and sound sensitivity. And nausea, which is feeling sick, and vomiting, and it can be with or without associated aura, like seeing light beams or spots and floaters. Tension type headaches are non-throbbing, non-pulsatile sorts of headache that are mostly unilateral, meaning just one side of the head, lasting from 30 minutes to 7 days. It's like a pressure type sensation of pressure and tightness around the head. And like migraine, it can have light and sound sensitivity, but it lacks the nausea and vomiting and the aforementioned aura. Rarely we can encounter cluster headaches as well as the rarer primary headache, which are felt severely behind one eye and lasting less than 3 hours, with eye-watering, runny nose, nasal congestion, and so on. And secondary headaches in children are mostly and commonly caused by acute febrile illnesses like influenza, common cold, and other upper respiratory infections, in which children can be feverish and have the associated symptoms. Headaches can start after a head bump or trauma. It can be caused by drugs as a side effect, or in case of pain relieving drugs, overusing them can cause more pain even. And other conditions like meningitis, tumor, severe hypertension, IIH, hydrocephalus, and so on. Should you take your child to a doctor? Yes, sometimes. Our pediatric neurologist used to say that children are not like adults in the realm of pain. They tend not to say that their head hurts, but when they say it's mostly severe, you should take your child to a doctor or a nurse if the headache starts after a head bump or a head injury. And wake them up or starts immediately after they wake up. Occurs by vomiting, neck pain, confusion, neck stiffness, loss of balance, high fever, and double vision or any sort of disturbances in vision. If it gets worse with motion, exercise, or cough. If you see these conditions, get your child to doctor ASAP. And as well, if they are younger than 6, have a certain medical condition like sickle cell anemia or get a headache more than once a month, you should get your child to a doctor to pay them a visit. If your child does not need to see a doctor or a nurse, let them rest in a dark and a quiet place and place a cool cloth on their forehead and encourage them to sleep if they are sleepy, because some headaches and especially migraine get better with sleeping. You can still give them medications if they don't need to see a doctor or a nurse, like pediatric acetaminophen, pediatric ibuprofen, but just please don't give them aspirin because it can cause a serious life-threatening condition called Reye syndrome. Some headaches can be triggered by certain foods and action. It's suggestible to have a headache diary for your child and write down anything they've done or they've eaten before the start of headache. Commonly, hunger, sleepiness, oversleeping, refractory eye problems, menstrual periods, too much or too little caffeine, stress, and some foods like bologna, like salami, can trigger headaches. So as you can see, I have started a new series about medical conditions and emergencies, what to do and when to seek medical attention. So if you have any questions and problems, feel free to ask, comment your suggestions, and I'll be reading and responding to all of them and take considerations about using them in the next videos. So that's it from me. See you until the next one. Bye.